Good afternoon, everybody, and welcome to today's session on health business investments in Africa in this year's AHBS webinar series. My name is Nishit Shah, Director and Co-founder of Africa Health Business. Before we start the webinar, I would like to take you through some housekeeping rules. Please post your questions in the Q&A section on your screens. There will be 4 pop-up questions during the session, and we encourage you to answer these. And finally, feel free to tweet about the webinar using our hashtag AHBS2021. I would also like to take this opportunity to introduce to you Africa Health Business, the organizer of today's session. AHB is a Pan-African consultancy and investment firm. Our team of specialists provide a wide range of services aimed at supporting and promoting the growth of the private health sector in Africa, with the overall aim of improving access to affordable quality healthcare on the continent. The AHBS series started as an in-person series in 2015, and today we have evolved it into an online platform with a series of new features coming soon. On this slide, you see the agenda for today's session, which will run for 90 minutes. Our keynote speaker is Dr. Babatunde Omilola from the African Development Bank, and he will be joined by some of the other speakers you see on the screen. While the COVID-19 pandemic has exerted significant strain on already overstretched health systems across the region, further affecting the delivery of essential health services, a broader spectrum of stakeholders is now feeling the consequences of chronic underinvestment. The impact of the pandemic has demonstrated that every sector is dependent on the health system. The challenges in the African health sector represent an opportunity for investment. The pandemic has spurred local manufacturing, increased our awareness for the need to invest further, and rely less on international supply chains. As our economies grow, the African Continental Free Trade Agreement represents an opportunity to prioritize health in all trade policies and programs and increase integration between African nations. UNECA estimates that these health business opportunities will be worth as much as $259 billion by 2030. Investing in African health systems is an opportunity to accelerate economic development and growth, contributing to saving millions of lives and preventing lifelong disabilities, and move countries closer to achieving objectives of national poverty reduction strategies as well as the SDGs. In 2019, private equity investments in healthcare amounted to $78.9 billion around the globe, of which only 0.2% was invested in Africa. However, there has been an upward trend over the last couple of years showing the growth of investments in the sector. As you can see on your screens, these are some of the most promising opportunities for investment in healthcare. And to highlight this, please feel free to respond to the first pop-up question on your screens. To deep dive into the session, we have an exciting lineup of speakers, and I would now like to introduce you to today's moderator, Dr. Amit N. Thakur, Chairman of Africa Health Business.
Thank you, Nishit. Thank you for your introduction and setting the stage. Let me just welcome all the attendees. I've seen at least 15 countries are participating on this. We have a lot of widespread attendance from Africa, but also from other parts of the world. Let me welcome you. Good morning, good afternoon, good evening, wherever you've dialed in from. I also want to thank the panelists who come also from different parts of the world today. And we are very, very honored to have some leading speakers in the health space that you'll be hearing from later on. Our keynote speaker is Dr. Babatunde Omilola, who is the manager public health at the African Development Bank, and he'll set the stage about the different opportunities. Let me just begin by saying that it's been very, very difficult with the COVID situation. Last year has been unprecedented. All of you know we've been struggling with supply chain. We've been struggling even now with vaccines. We've been struggling on treating patients who need basic care. And it all leads to the fact that we want to strengthen our health infrastructure and the health systems across. This is a golden moment for us to strengthen the African health systems through deeper and greater and smarter investments where private sector can play a very important role. This is a good time for us to bring in Dr. Babatunde, who will take us through his presentation and give us an outline. Please welcome to stage a good friend of ours, good friend of mine, Dr. Babatunde, to the stage to give his keynote address. Babatunde, over to you.
Thank you so much, Dr. Thakur. Thanks a lot for the invitation and thanks for the generous introduction. I'm delighted to be here today to address the audience on the health business opportunities in Africa. But before we go into the opportunities, I would like to talk a little bit about some of the barriers, some of the challenges facing health business in Africa. So next slide, please. I would like to talk through some of the challenges, some of the barriers, the way we see them, and then go through some of the opportunities that exist, and then mention a little bit about what the African Development Bank is doing and the role of the bank, and then show you some of the way forward in terms of how we can actually accelerate health business opportunities on the continent. Next slide, please. Right. So in terms of where we are, we now know that now more than ever, we should be focusing on increasing investment in Africa health sector. The COVID-19 pandemic has shown us that we need to do this. And now if you go back to history, you look at the Millennium Development Goals, when they were crafted, over a 15-year period, we know that we recorded some big achievements on the continent of Africa. One of our achievements was the life expectancy at birth that rose from around 50 years in 1990 to around 60 years by 2015. So that was a significant progress in terms of health situation on the continent. But nevertheless, there are so many challenges, challenges ranging from financing in the health sector, ranging from shortage of health workers to overall poor access to quality health infrastructure, which of course has been exacerbated by high out-of-pocket expenditures by most of our people on the continent. So the COVID-19 pandemic has actually deepened the health sector gaps and existing deficiencies. And I will show you quickly how all of these things have been done. But for us, again, at the African Development Bank, we know that our main role is really to support our member countries to build solid infrastructure foundations for capable health systems. And we can only do this by working with so many partners, with the private sector actors, with the public sector actors, to really focus on achieving the Sustainable Development Goal number 3 of making sure that we all have, we promote health around the continent, but also focusing on Agenda 2063 of the African Union. Next slide, please. So now I want to talk a little bit about some of the barriers and risks that are there in terms of investing in health systems in Africa. Today, I want to talk to you about 6 different barriers very quickly. The first barrier that I would like to highlight is the barrier in terms of the growing disease burden in Africa. Africa, as we know it today, is experiencing a double burden of disease with high communicable diseases as well as increasing non-communicable diseases. It is estimated that roughly 50% of deaths from all types of communicable or infectious diseases worldwide occur in Africa. And this, of course, is expected to increase, to rise. The second barrier is in terms of poor infrastructure. Africa has much lower density than any other region in the world in terms of clinical infrastructure. Recent estimates show us that the supply of beds is growing at between 1 to 4% slower than population growth in a few countries where data is available in Africa. The third barrier, that we face is in terms of spending in the health sector. What we know is that in terms of the overall gap in financing for the health sector in Africa, Africa requires around $66 billion every year to be able to meet the financing gap in the health sector. And we also know that approximately 36% of all expenditure in health in Africa by Africans is through out-of-pocket expenditure. And these would have to focus on. These are some of the barriers that we face in the health sector in Africa. Next slide, please. The 3 other barriers that I want to highlight very quickly, one of them is poor access to quality services. For us in Africa, ensuring access to quality health care for all at affordable rates is constrained by scarcity of public resources across many African countries. And that's why the high out-of-pocket expenditure is very high. Now, the 4th barrier is in terms of health worker shortage. Africa accounts for only 3% of the world's health workers population. And this is not good for the continent, especially if you look at many other countries around the world. Africa, we are having less than 5 health professionals per 10,000 population, compared to a global threshold of around 23 health workers per 10,000 population. The 6th barrier that we face, which is a big challenge for us, is limited private sector involvement in the health sector in Africa. And this, of course, is because of so many factors. One of them is a lack of coordination, weak regulatory systems, that really do not make ease of doing business in the health sector very easy for our private sector entities. And so for us, I will tell you what we are doing at the African Development Bank to really deal with this later on in the presentation, in my speech. Let's move to the next slide, please. Having mentioned some of the challenges, some of the barriers that we face in the health sector, now the whole idea is for us to actually turn a lot of these challenges into investment opportunities. And for us to do this, there are different ways to look at this. One is in terms of public health, the other is in terms of socioeconomics, and the third is in terms of investor climate on the continent. Those are three focus areas through which we can actually make our challenges to become opportunities for investment in the health sector. Next slide, please. Now, in terms of these opportunities for investment in Africa, I'm going to talk about 4 of those opportunities very quickly. The first one is in terms of universal health coverage. As you know, the attainment of universal health coverage for many countries on the continent is an imperative goal, not only in terms of achieving SDG 3, but also in terms of dealing with poverty eradication on the continent, and in terms of economic growth and economic development for us as a continent. Let me just give you maybe 1 or 2 statistics on this. To date, what we know is that it is estimated that 800 million people in Africa spend at least 10% of their household budget to pay for their health services. And this, of course, is very catastrophic because that then push a lot of people more into poverty, into extreme poverty. And that's for us the connection between health and economic growth, economic development, and poverty reduction, the way we look at all of this at the African Development Bank. So now, in terms of opportunities for investment, through the angle of universal health coverage, I'm categorizing this into 2. The first one is that private sector could collaborate with governments to leverage innovative and smart technologies, as we have seen in terms of biometrics, in terms of mobile payments, also in terms of telemedicine. All of this can significantly reduce inefficiencies and costs, especially in terms of health insurance. The second opportunity in terms of leveraging universal health coverage as an opportunity is through public-private partnerships. And this can be explored as a vehicle to harness private sector efficiencies and then engage private insurers to be able to support the management and running of public sector schemes in different African countries. These 2 opportunities, we have seen them taking off in some African countries, and they could actually give us some catalytic effects that can make us to accelerate progress in terms of boosting investment opportunities in the health sector. Next slide, please. The other opportunity that I want to talk about is in terms of health infrastructure development. As I said at the beginning, the COVID-19 pandemic has shown us that without ramping up our health infrastructure on the continent, we are not likely going to be able to deal with the current pandemic or future epidemics and pandemics. So for us, we believe that most countries in Africa, they actually spend a disproportionate amount of their health budget on infrastructure development. A good example is Zimbabwe, where in Zimbabwe, only 3% of the health budget is allocated to focus on infrastructure development. And this was actually a marginal increase in response to the current COVID-19 pandemic. So now, for health infrastructure development, we believe that there is a key opportunity for investment here. Private sector business could actually engage in infrastructure development contracts with governments. And these can be done in different kinds of arrangements. So let me give just one example under this particular category. The example is the partnership between the Tsepang Limited and Netcare South Africa and the government of Lesotho. And through this particular example, we have seen that it is possible for private sector business to come in and then provide the necessary support to our government in terms of providing bed capacity for citizens, for different populations in different African countries. Next slide, please. The other opportunity for investment is in terms of infrastructure manufacturing. Under this particular category, what we know is that Africa currently manufactures less than 2% of the medicines that it consumes. Current estimates are that imports cater for pharmaceutical market in Africa with only 3.3% of the pharmaceutical imports originating from within Africa itself. So for us to deal with this kind of issue on the continent, we are basically, I'm going to highlight two opportunities for investment in the pharmaceutical manufacturing sector. The first one is that businesses could leverage the recently established African Continental Free Trade Area, which provides economies of scale for continental production or for continental needs to boost manufacturing capacity on the continent. The second opportunity here is that the increasing trend of private equity players on the continent can help us look into unprecedented opportunity for healthcare companies to access private equity capital to expand operations in the health sector. And of course, we have already seen this in some African countries, and we can leverage more on all of these to really boost pharmaceutical manufacturing capabilities throughout the continent. Next slide, please. Now, the fourth one, in terms of where we see opportunities for investment in the health sector, is in the area of digital health technologies. As many of you know, since the early 2000s, Africa has witnessed a growing number of new private investment in health innovation. We have already seen the examples of digital health tools that are increasingly being used in many parts of Africa. A good example is what is happening in Rwanda, where the government of Rwanda has been partnering with California-based robotics company Zipline to be able to roll out all kinds of health services for their citizens. The next phase in Africa Digital Health Revolution is to see these innovations brought to scale in an efficient and sustainable manner. And that's where we have to focus on. And of course, there are many opportunities for investment in terms of digital health technologies in Africa. So let me highlight three of those opportunities very quickly. The first one is that business could leverage the iMobile device penetration on the continent to increase connectivity in the health sector. Mobile phones can serve as hubs to connect electronic measurement devices or more complex systems between primary care centers and tertiary hospitals. The second opportunity in terms of digital technologies in Africa is to use big data as a crucial component in many of our African country health systems. And governments, of course, are already exploring ways to do this, but we need to support them more to really strengthen their public health surveillance and disaster management systems by leveraging national data collection systems to inform planning and decision making. The third opportunity here is through telemedicine, which of course is already experiencing increased uptake across many African countries, even more now so as a result of the COVID-19 pandemic. So the offering here is really to make sure that we apply these using the African context and using the examples that could be leveraged in different African countries based on the particular situations of different African countries. Next slide, please. So now, having spoken about many of the challenges as well as opportunities for investment in the health sector in Africa, let me quickly speak about the role of the African Development Bank in all of this. We see our role in three different areas. One is in terms of investment in infrastructure development. Over the past decade, the African Development Bank has dedicated approximately 50% of its resources to infrastructure development projects. And in fact, since 1975, the bank has been investing in the health sector. The bank has spent over $5.7 billion in the sector, with 40% of that going into health infrastructure. So now the bank is actually the second largest contributor to infrastructure investment in Africa, with approximately $35 billion in commitments from 2010 to 2018 over all our infrastructure investments across Africa. So we are just second to the World Bank over this particular period between 2010 and 2018. So now that's our first area, and that's why for us as African Development Bank, we are currently crafting our strategy for quality health infrastructure in Africa. And this strategy will be released later this. The second area where we see the role of the bank is in terms of enhancing private sector financing. The bank attracts participation in public-private joint infrastructure projects with a portfolio of infrastructure for public-private partnerships valued at around approximately $1.5 billion. And the bank is engaged in multiple investment platforms and special funds to really enhance private sector financing. Last year, the bank approved a $10 million equity fund to support the Razorite Healthcare Fund based out of South Africa as an example of areas where the bank is enhancing private sector financing. The third area for the bank is that infrastructure, of course, is a major strategic focus for us at the bank. And that's why everything that we do going forward post COVID-19 pandemic, we'll be focusing a lot on infrastructure financing in the health sector in Africa. Next slide, please. Now, we believe as a bank, we have a huge competitive advantage, especially in terms of leveraging our different convening power to be able to enroll support of institutions and from our mandate. So we can do this clearly. Of course, we are also a trusted partner of choice, and we have broad financing instruments based on the needs of our member countries, based on the needs of our private sector entities, and also we have our institutional strength in broader infrastructure investment across Africa. Next, please. Now, in terms of the way forward, very quickly, let me recap and say that as a continent, we have a massive funding gap for health spending in Africa. Many of you must have been talking a lot about the Abuja Declaration, where African countries are expected to allocate at least 15% of their budgetary resources into the health sector. Unfortunately, most African countries have not been able to do this. We still have the $66 billion financing gap in the health sector. And so we have to find a way to fill these gaps. And there is a critical need to support health infrastructure development in Africa, driven by challenges in public health, significant financing gaps, limited private sector engagement, and strategic importance to African countries, as we have all seen due to COVID-19 pandemic. So the potential for investment is clear, and this potential should cut across 4 different areas: universal health coverage, health infrastructure development, pharmaceutical manufacturing, and digital health technologies. For us as African Development Bank, of course, we have been supporting our regional member countries and our regional economic communities when COVID-19 was declared an emergency in March last year. Our board approved $10 billion COVID-19 crisis response facility. And from that, we have been able to support our regional member countries in ramping up health infrastructure, but in dealing with social protection mechanisms for their citizens, in getting the necessary medical equipment, but also in terms of protecting jobs, and also in terms of providing liquidity to keep governments running throughout Africa. And of course, we continue to play that catalytic role to support our regional member countries. Let me also mention that as a bank, we value partnerships a lot in terms of what we do, in terms of boosting investment opportunities in the health sector. And that's why we extended $27.3 million grant to the African Centers for Disease Control and Prevention under the auspices of the African Union to deal with the COVID-19 pandemic by building its capacity. And that's why also we leveraged about $50 million to the World Health Organization, Africa Regional Office, to support our regional economic communities in dealing with the COVID-19 pandemic. And so we continue to do this. We are ready and able to improve the quality of life of the people of Africa. And we continue to do this working with different partners. So let me stop here. Thank you so much. And I wish you fruitful deliberation. Thanks, Dr. Taka and colleagues.
Thank you, Babatunde. That is really a nice overview. I'm hoping you will, interact with us as the panel comes through to the points that you have clearly mentioned. To the attendees that have joined us now from all the countries, look at this question up on your pop-up. It's how can access to capital in Africa to expand healthcare companies be made more readily available? Please answer the pop-up question. We'll share that with you at the end. It will also give us a guide of the useful views that you have. Let me thank Babatunde with at least the 6 barriers that you talked about, the 4 opportunities you talked about, and then you zoomed in onto the 3 main AFDB areas. As Africa Health Business, we are so delighted to partner with you on your catalytic role that you play on the continent, but the catalytic role that we play with the private sector, which will be demonstrated by the panelists that we've brought here and the attendees that we've been engaging. We are very well aware that the 15% Abuja declaration seems to be very difficult, but through partnership, every dollar that we bring in from private sector, matching it to public, we can try and reduce the out-of-pocket expenses. You are absolutely right about the 4 areas you talked about when you talked about UHC, health infrastructure, pharmaceutical manufacturing, and digital. And the kind of panelists, Babatunde, that we have are really going to talk about these 4 areas, which are in keeping with the actual top of the mind discussion on what private sector is thinking about. Let me introduce Mr. Tony Wood. He's very well known in this part of Africa. When we talked about telemedicine as one of your digital health technologies opportunity, nobody really knew about e-pharmacy many years ago. Tony Wood is the managing director of MyDawa, and I'd like to invite Tony Wood to really respond to a question around investments in the e-pharmacy. How will it make it more affordable? The catastrophic expense that Babatunde spoke about, when you can deliver medicine at the right place in the right time in a more cost-effective manner. And also, what challenges are you facing, Tony, to scale it up? Because even during the chief guest presentation, he talked about the regulatory landscape. When there is low private sector involvement, it's also got to do with the environment and regulation. So, ladies and gentlemen, please welcome Tony Wood to give us his response as our first panelist. Over to you, Tony.
Okay, thanks very much, Dr. Taka. So good morning, good afternoon, good evening on whatever part of the continent you may find yourself or beyond. This is a really important part. There are lots of areas where investment into healthcare is going to help take us on that road to universal health coverage. And I think all of those 4 points that Dr. Babatunde mentioned are going to help lead towards universal health coverage, because it's very important that the private sector takes a leading role in that as well. And it was rightly said, I am the managing director from MyDawa. So we are very much in that digital pillar. We're an e-pharmacy. We're very heavily reliant on technology. In fact, for a long period of time, I think everybody thought of us as a health tech business, and not so much as an e-pharmacy, because a lot of the conversations we have were around the underlying and underpinning technology. And I think that's the thing. And for me, I think technically driven businesses, or technology in business, whether they be digital businesses or whether they're using technology in other ways, really are going to kind of drive the efficiencies that we also need to see as we go forward. But it is absolutely that people like MyDawa, we can increase access to lower priced, guaranteed quality medication, and other healthcare products at a much better price and make them really accessible. Very often on the continent, if you sacrifice quality for price, and that's not really acceptable. There should be quality products available at every price point, and that point about manufacturing locally should also help us achieve that. But there's also a danger as well. I mean, especially as we've seen during the last 12 months in this pandemic, that as everybody rushes to get online and rushes to use technology, there is a danger that we expose ourselves to more substandard and falsified medication. We work with LegitScript, which is a global certification service. And what they've seen over the last kind of 12 months is over 400 cases of online fraud within healthcare. And most of those are relating to those where there's a purchase of health products or medication online. And it's no coincidence. I mean, everybody is really driving to get online now, as this pandemic doesn't seem to be kind of leaving us anytime soon. So we've really got to be very sure there. And when it comes to investment as well, we just need to be able to outline what are the benefits of a technology solution. Because as I say, lots of people can use technology for shortcuts. We use technology for efficiency and transparency, which allows us to provide a much better service, we believe, than a lot of areas. And it gets us into areas that not just within the urban areas, but we can, using technology, get far beyond the urban areas, out into rural areas, and working with partnerships. Even in the most remote areas in Kenya, you have clinical health workers, community health workers, who are all connected to the internet. So the internet is there even in those kind of most remote areas. But what we've seen is digital will be part of the future. Before the pandemic hit, we used to spend a lot of our time on behavioral change, on trying to build that trust and convince people that they could look at an online service, whether that be a telehealth consultation or something like an e-pharmacy like ourselves, that we could be part of their consideration when it came to their health requirements. Pandemic has hit, behaviors have changed. And this is a global issue, and it's no different in Kenya. I really do think that we'll be able to kind of build on this and move on this. We've seen significant growth from people who are accessing not just their medication and their food supplements and multivitamins, etc., but absolutely those who are just looking at their normal personal care and healthcare products and don't want to go out. They don't want to kind of mix with people, especially those that have underlying health conditions. So I think the digital part of the story is now here, and I think it needs to be something that will continue as we go forward.
I want to ask you a question on this, Tony, because I agree, digital is here to stay. The narrative has to change. Babatunde already highlighted it very nicely in 2 of his 4 points around telemedicine in UHC. He also mentioned it in when he talked about digital health technologies. Right now, assume that in Dakar, there is a lady going for vaccination and wants to just be sure that the vaccination is genuine. I'm using a simple example. Wouldn't it be very nice to have a simple technology, because I am so concerned about the substandard issue that you talked about, that it will start in desperation to be given as vaccines where they don't even have vaccines. So if you were to come and say, okay, let's use this, how would you respond to that to ensure that genuine vaccines are put in arms of people walking in?
Yeah. So, and I think that's a really important part. I mean, one of the things that we do is we look and secure our supply chain. And that's the thing. and especially now, vaccines. I mean, there was a thing in the media about South Africa where they picked up a number of counterfeit vaccines. I don't know how many people have contacted me over the last 3 or 4 months or 3 months to import vaccines from I don't know where. It's
Of
absolutely
course.
crazy. So we really have to be very careful in how we secure that supply chain. So you need to be making sure that everything is very transparent, and that's a great thing with a digital solution, where we're very transparent right down to the patient. So, for instance, we could dispatch a pharmacist or a clinical officer to administer a vaccine. We would know exactly what batch it was. We know where the customer is, what the patient and their details, and we can pool all of that data. I know who purchased what within the last 2 hours. I know who purchased it, what they purchased, and where it was delivered to. So the data there, right from the patient, all the way back in to be shared at a metadata level with the various regulators or ministries of health to ensure that you're able to track. So that should anything come along down the line, that batch number XYZ had a problem, we know exactly who had batch number XYZ, where they are, and how to contact them very, very quickly. So that whole digital supply chain right to the patient, I think, is something that we should look at, because with all the best will in the world, you go into a health facility, you're queued up, you're lining up, things are going to get mistaken, things are going to be messed up. So the patient will probably leave with exactly what he went in for, but the facility may not know exactly who got what and when, and how to contact them thereafter. So I think digital is absolutely there, right down to the patient.
You know what? We're going to come back to you on digital, but I'm going to now take a different gear and invite Jennifer. Thanks, Tony. Jennifer, I want to get to you on about GE. And you can see a pop-up question to the attendees. Are you interested in capital raising as part of your growth strategy for your organization? We would like to know. You've seen many structures around private equity. The banks are looking for interesting PPP projects. So please answer the pop-up and I'll come to Jennifer. Jennifer, GE as a company is a great partner, and thank you for your partnership and the work that you do has evolved. And you have literally seen what Babatunde has put across. And in his last slides, he talked about infrastructure development and the tune of 35 billion. And the biggest piece of their focus area is around infrastructure. Your company and your organization has been in Africa for many years, moving from equipment and high-end installations to literally making health systems more robust. What is your biggest focus area right now as GE Healthcare in making our systems more robust in East Africa? Jennifer, over to you.
Okay, good. Thank you so much, Dr. Amit. My name is Jennifer Kenyoe, the country manager for GE Healthcare in East Africa. Good afternoon, good evening, wherever you are in the world. So GE Healthcare is a leading global medical technology and digital solution innovator. We enable clinicians to make faster and more informed decisions through intelligent devices, data analytics, and applications. And we believe in our unique potential to improve lives in moments that matter. So what we're doing in healthcare, we're not just selling equipment, we're enabling the healthcare practitioners to afford this equipment. So GE Healthcare has set up an arm by the name GE Healthcare Financial Solutions. It's an arm of GE Healthcare that develops and runs financial solutions to support healthcare practitioners to acquire the much needed healthcare equipment. So we know that people want to invest. There is need for healthcare equipment. There is the hospitals coming up all the time, but not every practitioner will have the money upfront to be able to afford this equipment. And as you've heard from the keynote speaker, financing comes at the top of healthcare challenges across Africa. So this is not just we're not just doing it because we hear. It's something that's been researched on, and we know that financing will always come as a challenge when you're trying to expand. So for this reason, GE Healthcare has invested in a team of finance experts to support the healthcare sector in accessing financing for healthcare equipment. So for private practitioners, for example, if you're looking for equipment to grow your diagnostic center or to grow your hospital equipment needs, we have programs with banks, leasing companies, and other financiers who have an interest in healthcare sector. We work with these financiers to mitigate some of the risks that they find in the healthcare equipment sector. And we have found this to work because a lot of banks will say that I don't want to go and remove a CT scan, a patient from a CT scanner or an MRI, because then I face reputational risks.
Yep.
So you find that banks are finding it more comfortable when we go in, we risk share with them, we support them in, evaluating some of these customers to make sure that they're making the right decisions.
Right.
We enhance the appetite of the financiers who would not ordinarily fund those equipment. And there are very many other risks that we try and mitigate. So some of the other value adds from our financing programs is that, for example, the banks are more receptive when there's a risk sharing program, because as you all know, banks are very stringent and they won't just let their money go out to a customer without a lot of, detailed KYC.
Sure.
You also have quicker access to the loans. In some instances, we have programs where there is no upfront payments, like the leasing programs. We have programs that have tax benefits. For example, the leasing programs, they have tax benefits. And you get support from an experienced team of finance professionals in building a business case and a compelling case for financing.
Sure.
Then for the large projects, for the large ones, like the brownfields, the greenfields, we can develop solutions as well. Public-private partnerships, which remains one of the financing models for long-term infrastructure development in the healthcare. The government can actually provide crucial infrastructure without large capital outlays that usually happen with such projects. Such a project we have is in Kenya, where we have an MES structure. MES is Managed Equipment Service. This structure would, normally be applied to a greenfield or a brownfield development. And the key principle is that procuring entity, which in most cases will be the Ministry of Health, pays a unitary charge over the duration of the MES. It could be quarterly, it could be annually, semi-annually. And at the back of the structure, we arrange an integrated financing solution with a local bank in whichever country we want to do the MES. But this requires a lot of collaborations with commercial funders, insurance providers, credit insurance providers, export credit agencies to mitigate some of the risks.
I have a question for you, Jennifer. Many people who've logged in understand that in the past, when they wanted to install a CT scan, like you mentioned, they would need to raise their own funds or go to the bank. You've added a new dimension. And I think when Babatunde presented on quality, you're making quality equipment reach in Africa where it did not reach. And you're also making sure that financing is there. Affordability was a big question. And by the way, still is. Many healthcare clinics and hospitals all over Africa struggle to buy some amazing equipment that would improve quality. And now you're creating a bridge in between them. My question is that, the leasing part that you mentioned is pretty interesting. And I want to get to that. You really don't need to buy the scan. You have a system that I can place in my clinic in Cameroon or Botswana or in Egypt, and I can continue paying as per use. Could you talk to me a little bit about that?
Yeah. So when it comes to leasing, there are very many models. So there's a model where we work with the leasing company. The leasing company becomes the buyer of the equipment. They buy the equipment from GE Healthcare, bring it to your premises. You work with the equipment as you pay rentals to the leasing company. So it's like you're renting it, but from the leasing company, and you pay your rentals on a quarterly or a monthly basis. over the period of the lease. And at the end of the lease, depending on whether it's a finance lease or an operating lease, then you can either return the equipment, get the new versions, new models, new technology, or you can actually buy the equipment at the end of the lease. So leasing models have been seen to work, especially because there are so many benefits. For example, there is a tax benefit, so your lease rentals can be deducted as your other expenses, say your payroll expenses from your P&L for you to arrive at the taxable figure. And then in most of the leases, because you're not the one buying the equipment, the leasing company is buying, you actually don't have a huge upfront capital outlay. Maybe some you may be paying some some fees, but you're not paying a whole down payment at the beginning of the lease.
Fantastic.
Models to work very well. There's also the pay-per-use model that is also happening in some of the places in the world and in Africa, whereby you pay per use, you get the equipment, and then you pay as you use. So
Nice, very nice.
and you continue to pay as you use it, and the contract is in such a way that it's time bound, and at the end of that, you either get new technology or you get refreshed technology to continue using the equipment.
Thank you so much, Jennifer. I think it segues nicely to
Yeah.
Dr. Gacombe. I want to change, and I'll come back to you, Jennifer, later.
Yeah.
But
Yeah.
let me move to Dr. Kanyenje Gacombe, who is the CEO of Metropolitan Hospital, part of the Evercare Group. And Gacombe is an entrepreneur and a medical champion in Kenya and East Africa. And Gacombe, I want to bring you in just after Jennifer, Tony, and Babatunde on the healthcare space that you've been in for a long time. What have you noticed generally as the trend? I've heard about leasing, that's new. We never had it when we started our hospitals. I've heard about digital health, that's new. So I think there's been an evolution. I want to hear from you, what is the trend that you've noticed for primary and tertiary healthcare facilities? And literally hear from you, what are we looking for from the people who have logged in and want to create stronger partnerships? What is private sector looking for in Africa? Please welcome Dr. Gacombe.
Thank you, Amit, and I'm very pleased to be on today's panel. Yes, I've been around since the 1990s, so and the fundamental changes at several levels. The first is in the payer-provider mechanism. The traditional payer-provider mechanism was fee-for-service. We passed all the risk and all the cost to the patient. That's changing. We are moving to DRGs, fixed price models, capitation. In Kenya, the leader is NHIF, but increasingly we are seeing insurers get into that space. And just today, I was dealing with a request from one of the largest insurers to give them a fixed price for maternity care. So that's a change. The second change is that traditionally, in the old days, you would have pairs of appointing two entities. One would be the hospital, the second would be a panel of doctors. That's now history. Hospitals are now being contracted to take care of everything. It means now the contracting between the doctors and the hospitals the contracting for the doctors has moved to the hospital instead of sitting at the level of the insurer. And it's up to us who are in the delivery value chain to agree how to share the value and the risk. The third change is in digital health. Because we are changing from fee for service and out of pocket, it means we must have better connection between we, the providers, and those who are paying us. And that means that somebody must provide a bridge between us, whether that bridge is in carrying medical data or financial data or membership data. We have evolved a new industry of companies like Smart, companies like Slade in Kenya, who are providing connectivity between payers and providers so as to eliminate paperwork. The other change is that is at financing level. When I started off, the only people who are willing to buy shares in the business were friends, family, and fools. You know, the three Fs.
Of course, of course, of course.
I collected money from my
Yeah.
mother-in-law and from my mother and my colleagues and friends and started the hospital.
Yeah.
3 years ago, when you're looking for a private equity investor, we had a team of 10 of them close one. That's a fundamental recent banks have been more willing to lend to the private sector. So there has been an acknowledgement that private for-profit player has value to add in terms of providing additional infrastructure. You find that you get financing from a myriad of sources, and one of them is the one that we talked about, model where we have a lot of placement models for various imaging in laboratory. Laboratory equipment is pay for reagents and the equipment comes free. So we are not spending capex to get the equipment. And of course, coupled with that, because we are the ones carrying risk, then it becomes necessary to have more efficient operating systems. So the use of digital health, hospital ERPs, electronic medical records, decision support systems for clinical work and dispensing has become necessary. And telemedicine, teleradiology. In our case, we use teleradiology because we can't afford a resident radiologist, so our images are reported far away from here. And so the digitization of the sector is not just something on Africa Development Bank presentation. It's there on the ground in Maidawa, in Metropolitan, in Smart, in Slade, in insurance companies that are digitizing their systems. So it's an ecosystem-wide movement. And of course, because there is really a shortage of healthcare workers, especially in critical care, we are beginning to evolve to become trainers of human resource. A number of private entities, Current Hospital, Outspan Hospital here in Nairobi, Men's Hospital within our ecosystem, are training at the level of nurses and auxiliary health workers. And of course, we now have private universities that are even offering medicine as an undergraduate course, which is paid for and provided for by a private investor.
Sure.
It was only the government of Kenya that decided whether you became a doctor or you didn't. Now, if you can afford to pay and you have to pay, you can go to a private university. So these are all changes that I've seen happen in the last, especially the last 10 years, and the last 5, with the speed is increasing over time.
We're losing you a little bit, Gacombe, there. There was a bit of a muffle. Can you hear us?
Yes, I can.
Okay, yeah. Yeah, go ahead. Your last point was?
I was saying that the pace of change is accelerating.
Yes.
I've seen more change in the last 3 years than I did see in the past 10 within the industry. And COVID has just accelerated that thing much more. Because there are things confronted, like those claims for insurance that are no longer tenable.
Great. Let me ask you one question before I get to Jeff. And it's really your opening statement about the payer-provider mechanism.
Yes.
You know, it also touches on Babatunde's presentation on quality. You're almost indicating to us on the webinar here today that we are going to be paid for quality, where private facilities were being paid for units of service, now they'll be given payment for units of care. So how you manage your own care to the best efficient standard, and the rewards will be based on either a capitation, fixed price, or DRGs. I want to hear from you how healthy this payer-provider mechanism change is going to change the landscape for 1.3 billion people on Africa?
The first thing I want to say is that it is inevitable. Because as we move into UHC, there will be greater demand to get value for dollar or shilling or whichever currency that is in a particular country. And the fact is that payers will increasingly become more powerful relative to providers. What they're going to do, they will be looking for better value. And better value comes in terms of quality and so the solution that the provider now begins to be the one managing quality and cost.
Could you try Gacombe without the video and repeat that last statement? Might be easier. Try now.
Yes. So I was saying that
Perfect.
the transition is that for all of us providers, we could pass on all our waste and poor quality to the payer, to the patient, to an individual. Now we're dealing with organizations that can afford health economy, they can afford doctors, they can afford well nurses to do our work. So we have no choice as providers, but to improve the quality of care we provide and simultaneously improve the participation.
Thanks. I think we'll move to Jeff now here. Thank you, Gacombe, for those insights. I heard from you that it's pretty inevitable. Jeff, you've heard the whole ecosystem in Africa, and I think local manufacturing, Babatunde brought it up as one of the big four. And the logistics of health commodities in Africa is quite attractive, and many people, airline companies, digital companies, distributors are all garnering up. But still, there seems to be not as much success for domestic or foreign direct investments in the continent. What's stopping it? What do we need to lift as a barrier? Maybe some of the barriers Babatunde brought about. And how can we make it more self-sufficient in Africa for Africa? Let's hear from you. I'm delighted to invite Jeff Imans from Chemonics, who is actually an advisor on health supply chain, dialing in from US. Please welcome Jeff on the podium. Jeff, over to you.
Thank you very much for this introduction. That's indeed a very good question, especially after all the answers that we've heard before. In Africa, typically health systems and health supply chains are run by governments, supported by donors, NGOs, FBO, and others. But despite all that, the private sector still faces a lot of challenges when engaging with the government entities. One of the main elements in this is that private sectors view working with the governments as very risky. There is, of course, the financial aspect. Governments in Africa do not always have or have limited financial resources, but also the lack of proper procedures and the increased bureaucracy mean that there's often delays or default on payments done by the governments. A second element is that very often government and donor contracts are very short term, which increases the uncertainty for the private sector. The private sector typically looks at investments on a long-term basis, and when contracts only come in a short-term basis, it really decreases the attractiveness of doing any investment in Africa. There's also the general adverse enabling environment for business in Africa. We can have changes in contracting terms, we can have changes in conditions, a change of government and a change of political direction often filters through in those contracts. And again, all that adds to the lack of stability for the private sector. Another element that is worth mentioning is that, especially when there is performance metrics involved in payments, and especially performance-based payment, they're not always standardized, they're not always well understood. And again, that increases the lack of clarity, the lack of stability for the private sector to actually engage in those investments. Not specifically related to the health supply chain, they can be barriers that prevent especially foreign direct investments, they can be based on a fear of loss of control of the health sector. But even the governments themselves, they do not always are capable of presenting a clear business case to the private sector. And finally, and again, that's specifically important for the health sector, is that there might be concerns over job losses in the public sector as the private sector grows. And finally, there is also an aspect of non-transparent business and contracting practices, which makes it harder for the private sector to define their business case when making investments.
Sure.
So one of the ways to address some or even all of these challenges is that governments could go more and more towards a stewardship model, where what that means is that they can ensure, first of all, a more sound financial flow and financial integrity of the payments from the government towards the private sector. There is the need for creating and maintaining regulatory policies and procedures so that both the public and private sectors can thrive. Quality assured products need to be insured. And it's been mentioned a few times before, there need to be clear disincentives for counterfeiting. And all of that, the general aspect of the stewardship is that there needs to be more coordination also during public health and other disasters, like, for example, the current COVID pandemic. Any coordination led by the government can help increasing that model of stewardship.
Great.
And maybe to follow up on that, what is really needed to get there is that both the workforce capacity, the processes and the policies and the system need to be increased and improved. We need to have an enabling environment for private sectors to thrive. And that is a key element in all that. There needs to be looked at ways to de-risk the private sector investments. Private sector is always looking at the least amount of risk and the highest amount of stability.
I'm going to get in very quickly, Babatunde, also on the call on this conversation. And, Babatunde, you presented a very nice opportunity matrix, and we can create an environment. But what I think Jeff's brought about leadership and stewardship model. If we invested in leadership in public sector and maybe also private sector, then chances are that we will have people in the ministries of health in Africa who understand PPP. So Jeff, about 6-7 years ago, there wasn't a single person in the Ministry of Health in Africa who had a title called PPP. And then through our push, there's a PPP unit, and it's a salaried position of somebody who's supposed to understand the sound and integrity about payments, assurance of quality, dealing with counterfeits, and growing that partnership. But I still believe that the weakness in the ministries of health around how to deal with private sector is one impediment which you are talking about. Is that something, Babatunde, are you able to just give us your view on this, as Jeff has mentioned, what you think about that? And Jeff, what is your response? If Babatunde is online, let me ask his view about this. Jeff, why don't you have a chat on that?
Well, I think, as you say, it is a relatively new phenomenon, but there is definitely an increased interest from the public sector in these public-private partnerships. And what is important to understand for mainly the governments is that public-private partnership and the concept of stewardship model does not decrease the government's responsibility. I would say rather the opposite, because it helps leverage the comparative advantages of both the public sector and the private sector. And as long as the public sector understands the needs and expectations of the private sector, but also that the private sector understands the needs and expectations and the ways of working and the sometimes different interests that the public sector it's only through that common understanding then that you get to a good way of collaboration that leads to the most sustainable solution for the country.
So I wish we had something called a trustometer, like a thermometer. And if we did have a trustometer, I wonder if there was some measurement, but I think you're spot on. Let me ask you one more question before I bring up some interesting questions that the panelists should talk about before the parting shots. Tony and maybe other panelists, there are some questions coming in live. Feel free to answer any one of those directly. Jeff, in just 2 minutes, innovation. Tell us something about an overlay of innovations in supply chain that's going to be a game changer in our health systems. What's your take on that?
Thank you. Thanks very much for that question. I'll try to keep it brief because I know we're running out of time. First, what is important there is innovative financial approaches to de-risk the private sector investment. As I said before, the private sector always wants to minimize the risk and increase the stability. So
Right.
Coming up with methods that reduce that risk of the private sector investments when the public sector is the client, that's an absolute priority. A second one is creating a stable environment with a stable demand. In the public health supply chain, demand tends to be not stable, tends to be very unstable, tends to be all grouped in maybe one big procurement per year, which is not very attractive for a private sector. A private sector company will always prefer to have rather 12 orders every month rather than one big order per year. It is just a lot easier for them to plan in, and it increases the stability. And then thirdly, the use of technologies is super important. It has been mentioned a few times before, but in general, every time that technology can be used for improvements in effectiveness, efficiency, and especially as well end-to-end data visibility, that's well basically the supply chain operations can get a higher reliability of data for forecasting and planning demand. And then maybe, and as a bit of a side note, what is really important, and I'm not sure if it's innovative or not, but local partners are always the preference because they have more long-term interests and will be able to respond more nimble to the market. They can be supported, or they should often be supported by maybe established international partners to provide scale, technology, and expertise. But as the local partner grows, that expertise and that technology should be channeled more and more to the local partners, so that basically we create a more sustainable environment for the country.
I couldn't agree with you more. I think this pandemic has shown that truly to the core of local partnership. And thank you for those innovation points that you raised. I want to move to some of the questions that have come in advance. And on the next slide, we will show you some of the questions that have been posted that I want to give to the panelists. So if we can take this option and look at this, let me start with Babatunde. If you're there, can you hear us? One of the questions was, how good is health business investment in Africa compared to other regions? I want to give 1 minute each to the 6 questions that we've got, and then we will open it up to parting shots. We've got only about 20 minutes to go. So let me ask Jeff Gacombe and Babatunde to quickly have a look at these advanced questions that have come from different organizations. The first one is from Global Fund. And Babatunde, if you are able to respond, the question is quite clear. How good is health business investment in Africa compared to other regions? If you can hear us, if he's joining us in a bit, let's move to Gacombe. What is the most urgent thing requiring financial investment to combat the pandemic at the moment? This is from NHS. Gacombe, you want to go for that?
Sure. You want me to answer it now?
Yes, go ahead. Go ahead now. That is good.
And today we started immunizing those who are over 58. The most important thing we must do now is make sure the vulnerable are immunized. COVID is becoming endemic, so the strategy should be to protect the older citizens and make sure the second, and it's almost the precise opposite, is that we may run out of oxygen. The most critical treatment for many of the patients is access to high flow oxygen, and our generation capacity may well run out in that. Scaling up vaccination and ensuring that we have adequate supply of oxygen in our health facilities.
Thanks. Okay, so we heard from Gacombe that Kenya started vaccinating over 58, so it's bringing in another population that's vulnerable, and we also heard about oxygen, that when they do get sick, we want them to recover, and that supply is important. Let me move to Jeff. Here's the question: how can sustainable development in supply chain management help universal health coverage? I think help attain universal health coverage in Africa from FHI 360. Over to you, Jeff.
Thank you. I think that's indeed a great question. Where sustainable development in supply chain management mainly helps is getting the right product at the right place at the right time.
Yeah.
A product is only useful for its patient when it's there at the time that he or she needs the medicine. That is an absolute. I mean, it is not even a way to improve healthcare. It is a condition to achieve that universal health coverage. Once you have those basics in place, you can really start analyzing the flows of the products. You can start predicting your demand. You can start predicting the required supply. And as I said before, by having a more stable environment and having a more stable demand, that's when you can actually attract, again, that private sector to participate in that. So having, to summarize, investing a lot in the last mile delivery, the procedures to get there, the technology to achieve that, the technology not only to increase efficiency and effectiveness, but also to achieve end-to-end visibility. That's probably, these are some of the factors where health supply chain management can really help to achieve that universal health coverage.
Let me ask you one question on this. Blockchain, buzzword, everything's happening. Should we be putting blockchain under a microscope and testing its use, or is it a fantastic waste of time?
I guess it depends very much who you ask the question. Blockchain is definitely not a silver bullet. It is not the magic solution to all the problems. Where blockchain, however, can really help is especially counterfeit products to ensure and to again increase that visibility of the whole health supply chain and allow a full history of the product at the final destination. So blockchain is one way to achieve that, but is by no means the only way to achieve that. And taking into account that in Africa, very often internet connectivity comes still at a premium price, and blockchain is quite demanding on internet connectivity and data exchange. It might not always be the most sustainable solution. But having said that, the principles of blockchain are absolutely worth taking a look at to use in that health supply chain.
I love that diplomatic answer. Thank you, Jeff. We are moving on to the next slide of the questions. And here we'll go to Jennifer, then Tony. I'll try and answer the last one as well. We have a question from Swedfund. Doreen has sent. Where do we source for healthcare opportunities that have impact and are scalable? Where do we source healthcare opportunities? I guess this is literally about, we want to put funding into things that will enable impact. So over to you, Jennifer. This is really down your alley. Go ahead.
Okay, thanks for the question. Okay, so where do we source healthcare opportunities? So opportunities are there, and they have to be scalable and bankable. And by scalable, I mean it has to be a healthcare project that will grow over time, that will continue to grow organically or with investments much faster. And where we source for them is, I'm not sure I understand the question where we source for them, but I guess there are partnerships that you can get into to get opportunities. You can get into, existing businesses. For example, we have standalone radiologists in Kenya, for example, who actually go and look for opportunities in existing hospitals and make a business case out of it. So you're a radiologist, you buy equipment, go and place it in a hospital or in a diagnostic center and start to earn revenues and share revenues with the owners of the hospital. So where you source opportunities depends on where you want to invest and what you're interested in. And opportunities that have impact and are scalable, that comes from either growing that business or trying to look for funders to try and help you improve on that business.
Sure. And I think that's really good, because I think here is where AFDB plays a big role. Organizations around models of funders, institutions. The answer to Doreen is literally around keep in touch with the health network. All of us here seem to have a health network, and there are specific groups of network that give information. And I think one of the poll questions was, how do we freely make some of this information available? Data isn't that easily available. If I had $1 million or two and I want to invest in a healthcare business, which is scalable, it's sometimes you have to really fish hard to look for a good project. And I think we as healthcare people on this area, we need to do a little bit more. But yes, I think we really need to do more, Jennifer.
Yeah, and I believe you as Africa Health Business, you have the opportunity to put investors, funders, healthcare providers, equipment manufacturers, so that we are all in one pot, and it's easier for people to find these solutions in one place. So
I like that. We're going to
advantage places where you can put us together.
We will definitely do that. We'll be the catalyst. We'll play as much as possible to be the central role, so that we can actually provide momentum towards having a larger impact on all of the excellent players that we've brought together in many of these forums. Let me move to Tony now. This is a good one. Meshak is asking, is it a waste of time to get shareholders looking for returns of investments when they go into a healthcare business, and you just do it for fun? You need to be altruistic. Who says you should make money from people who are sick? What's your answer?
Yeah, this is this is that age-old question, isn't it? As are people allowed to make a profit from healthcare? So I think, to be honest, yes, there is those that are in philanthropy and those that are providing funding and grants for various things within healthcare. There is obviously the public healthcare system, but when it comes to the private healthcare system, that has to be sustainable. The only way that that can be sustainable is by making some level of profit. And some level of profit is there to feed back into the business, to grow the business, etc., etc. So to be honest, yes, I think it should be profit orientated to an acceptable level. This is not about profiteering; it's about making a reasonable profit to grow sustainable businesses. And let's be honest, we're all early stage businesses. We've been talking about financing and funding for quite a bit during this call, and you will not attract funding from a PE fund or a VC fund or anybody if they're not going to make a return on their investment, and that's just fact of life. So I think it is okay to make a profit. It's not okay to profiteer. And there's been too much profiteering over the last 12 months.
Okay, I think that's a very good way of saying that too much or whatever. I think profit and plunder are different things. When you offer value and people appreciate it and they pay a certain price for a scan or a lab test or a consultation and they are happy to receive that service, I think that's profit is very well accepted. What is wrong is when you give people counterfeit, substandard products and start making these huge margins and create theft in the process. I think that is where most of our health budget is being lost into the system. Let me move to the last question. The African Continental Free Trade Agreement, I think it'll affect the healthcare delivery on the continent. The way I see it, we will have a lot of intra-Africa trade like it is in Europe. 70% of Europe has intra-European trade. At the moment, we sit at 17%. And if you looked at the figures that Babatunde shared, we produce less than what, 3% of the pharmaceuticals we produce. We consume less, we only produce 3% of the pharmaceutical demand that is consumed in Africa. So I see a lot more intra-Africa trade. There'll be free movement of goods, labor, and services. And I will also see a nice way of reducing costs. But it needs to have a unified movement, and it's going to take, I think, between 5 to 10 years before we see impact. But thank you, Sam, from US with those questions. And I want to thank everybody who sent these amazing questions from different parts of the world. I have seen so many people still logged in. Let me share the poll results that I want to jump in next. The first question that we did ask you, wow, it's an overwhelming blue. I think partnerships and incentives from government for investors in terms of a conducive environment is, okay, this is quite clear. It seems most of the panelists and I think attendees are saying, let's just give us the environment and private sector can do the rest. I think we are like water. Give us a nice path, we'll find our way. There are a few who are saying aggressive fashion. Next poll result. This is quite interesting. It's quite evenly spread, this answer. Are you interested in raising capital? That's great. We have many people logged in, at least half who are looking for some kind of funding. So I hope you found this session useful. Feel free to contact us if you want more information on capital raising, or many of the partners here are willing and able to do so. I also want to go to the next question, next poll. This is also quite evenly distributed. How can access to capital in Africa to either start your business or expand your business be more readily available? There is government to offer tax incentives. It seems that's a big issue for health companies to allow easy operations and expansion. So there is a 45% answer there. But there is information on organizations, also an important tool, and finance institutions to have less stringent requirements. And Jennifer, maybe you come in here as a bridge, because if the banks are really strangling you, give you a business plan, ask you to produce a raft of things, and they never get the money that they want to make a new lab or a new doctor's plaza or a new hospital. So people like yourselves and others actually become a good bridge. Let me jump on to the next slide that we want to come to, and that is parting shots. Let me start and request Babatunde, if you're still there. This is the last poll question, and this is really from you to us. If AHB can help your health investment strategy in the journey, how would you like us to do more of what we've been doing? And it'll help our team to manage in putting the next health investment webinar together. Dr. Babatunde, are you here with us? We would like you to give us your 1 minute, half a minute parting shot, and I'll go to the rest of the panelists. We did appreciate that 643 presentation. Babatunde, over to you.
Thank you so much, Dr. Taka. I want to thank you and all the other organizers for this particular opportunity to engage. As I've said in my speech, there are many barriers, to entry into health business on the continent, and many of these barriers we can deal with them effectively because we have so many opportunities in the health sector on the continent. In fact, our recent estimates show that Africa health sector market will be worth around $259 billion by 2030, with the potential to create over 16 million jobs across the continent. So we have great potential in the health sector. We just need to find a way to create that enabling environment for private sector engagement and participation. And as I've said, there are 4 different areas through which those opportunities exist for us. One of them is around universal health coverage. The other is around digital health technologies. The other one, which I think is also really, really very important and which we are focusing on as African Development Bank, is around health infrastructure development. And that's where we really look forward to partnering with both public and private sectors on the continent to really ramp up our health infrastructure on the continent, not only to deal with this current pandemic, but to deal with future epidemics and pandemics across the continent. So again, I look forward to engaging further with you and with others as we'll move on in terms of boosting investment opportunities in the health sector on the continent. Thank you so much.
Thank you, sir. It was really amazing. Thank you for setting that stage. Let me invite Tony Wood to make a short parting remark.
Yeah, no, well, thank you very much. I think it's been a really interesting conversation. I think the theme that's come through a lot of the time is that everybody really is trying to pull together towards universal health coverage. And I think we're all very focused on delivering that and doing that through partnerships. I think digital is now come of age. It's now an integral part of the solution. It's not the solution, but it is absolutely part of the solution. And being able to provide a quality service, especially now during the pandemic, where people are concerned to go to a health facility, and we've not mentioned it at all yet, but where there's an element of social stigma and they don't want to go to a health facility. One of the things that I heard on one other event was that our business model wasn't designed for a pandemic, but it's very, very suited to those who are living through and managing through this pandemic. So I think digital will continue to be an integral part of the conversation, and we look forward to being able to be part of that and to continue the growth on the continent towards UHC.
Thank you, Tony. Thank you so much. Jennifer, over to you for your closing remarks.
Thank you, Doctor. Yeah, this has been an exciting session, and the polls show that we need to do more to support with the healthcare investment. So as GE Healthcare, we do not just stop at selling equipment and supporting with financing. We have teams who support the operators with technical advisory on your investments. We have teams who actually take you from A to Z of the journey, from the concept of your hospital or your project to full installation. So we have local teams, we have global teams, we have teams across Africa, and they'll work with you and your teams. They'll work with your architects, they will work with your engineers, civil work engineers, and come up with a plan for you to get your investment to the right level and to have the right equipment in your hospital once it's built. So if you need support, with large infrastructure healthcare projects, please do come to us and we'll support you. And we have a very good, place where you can contact us through the Africa Health Business.
Thank you, and also start helping medium and small sizes as well, because we're in Africa. So it'll be great. Thanks, Jennifer. Let me invite Dr. Gacombe for his short remark as we close.
Thank you, Amit, for inviting me. It's been a pleasure to be on the panel. Mine is simple. I want to make a couple of points. The first is that in a continent that is resource constrained, we must do all hands on deck. Everybody who can do something to help must be brought on board to help. And the debate about faith-based private capital is not the center stage. It's about what value one brings to the table. The second is that we must innovate, and digital health is but one of the ways we can do it, because we have a lot of waste and by innovating. So the time that we must scale, and part of the reason I took on an investor is because that investor allowed me to scale and be able to do a lot more, not just in Kenya, but in Nigeria, in Southeastern Asia.
Thank you, Gacombe, for those closing remarks. Jeff, your final parting shot.
Thanks, Amit. First of all, to repeat what others have said, I think this was a very interesting conversation, very interesting discussion with a lot of good points raised. I think you mentioned it very well. I think within governments, a PPP person is becoming more and more the norm. So on the side of the governments, but also of the donors, there is definitely an understanding that public-private partnerships are the way forward. At the same time, we see from the private sector as well more and more willingness to move towards those partnerships, understanding that it is not just private sector approaches that help, or it's not just a private sector mentality, it's really finding the middle ground between the public and the private sector and both of their interests. And the use of technology is absolutely a catalyst in achieving that, is a catalyst in bringing them together. And I think we can definitely conclude that that we are at the moment at a time of opportunities for both the public and the private sector to step in and get the healthcare to the next level absolutely required in Africa.
Thank you, ladies and gentlemen. Thank you, the attendees. Like everybody is saying, together we are stronger under the PPP framework. Together we can have greater investments. Let me invite Valentine Kamau now on stage to take us through some of the interesting developments that are happening and appreciate the partners. Valentine, I welcome you. It's over to you.
Thank you. Thank you to all the panelists, full insights, and delegates for attending the webinar. Save the date for the next webinar session on 8th April, focusing on Africa's readiness for the COVID-19 vaccination drive. We will have a powerful panel moderated by AHB Head of Pharmaceuticals and MedTech, Ms. Kaushal Shah. Insights will be given by various panelists, including Science Advisor for Africa CDC, Dr. Nikais Dembi, and COVAX Coordinator from UNICEF, Ms. Tara Prasad. Other panelists will be from Amref Health Africa, Broadreach Healthcare, and Astral Aviation. Next slide. I take this opportunity to thank the sponsors, without whom this event would not be possible. Next. To connect with us, feel free to reach out to me with the details on the screen. Thank you and goodbye.
Thank you, everyone. Thank you, Valentine. Have a great day, everyone. Take care.